Access to health care continues to be a top issue for many here in Michigan. And today, critics of the federal health care strategy spoke out on what they say are rising costs and coverage cuts, as the latest numbers tell us what the impact may be. 13 on Your Side political reporter Josh Albertus has the story.
I was just talking to a nurse practitioner last week who takes care of a 30-year-old mom with kids.
For Megan Erskine, CEO of Catherine's Health Center in the Grand Rapids area, the story of healthcare has a human face.
She has poorly controlled diabetes, and she does not get health insurance through the marketplace because she can no longer afford it. She chooses to put food on the table and keep a roof over her kid's head at the expense of her health.
Erskine gathered with other leaders Monday morning following a new report from the group Protect Our Care, which cited sources like KFF and Georgetown University, as well as past projections from nonpartisan left-leaning think tanks. KFF citing numbers like these from the Federal Centers for Medicare and Medicaid Services that showed from February 2025 to February 2026 about 130,000 fewer effectuated enrollments in Michigan, meaning 130,000 fewer enrollments with active marketplace insurance policies who had paid their premium for the month.
That's a 27% drop in just a single year.
Critics argued it comes amidst big changes from Washington. Expiring Affordable Care Act tax credits at the end of 2025, many feared, would lead to skyrocketing premium costs. According to KFF, premiums had risen by an average of 58% in 2026.
There is nothing inevitable about healthcare becoming less affordable or less accessible. These are policy choices, and Congress can and should make different ones.
Many also worried the rollout of Congress's One Big Beautiful Bill Act could throw Americans around the country off their health insurance through changes like new work requirements for Medicaid, touted as a way to ensure only those in true need receive benefits.
This is about making sure that we've got able-bodied people who can work. Why would we have them on the government dole and not on a payroll? And again, this is not about someone who has a dependent, either an elderly dependent or a young dependent, or who is not physically or mentally capable and able to go work.
This may sound reasonable and practical, but for individuals who have difficult and challenging work schedules, are gig employment, or have gig employment, are caregiving, or have limited digital access, this is just an administrative burden.
And Josh joins us now here in studio. Josh, do we know anything about how Medicaid enrollment has also changed here in Michigan?
Yeah, Julia, outside of the report, state records say there were nearly 100,000 less enrollments in Medicaid and Michigan's Medicaid expansion program here in the state between this past June and a year prior. Those data points we mentioned don't know why this happened or if previous enrollees ended up getting coverage elsewhere, but critics are drawing attention to that context nonetheless. Juliet.